If you're facing mastectomy and no one has mentioned nipple sparing to you yet, I want you to watch this video before your next appointment, because this is one of the most important questions you can ask, and most women never know to ask it. Welcome back to Becoming Beautifully Built. I'm Wendy, a breast cancer survivor, 6 years out from my own double mastectomy with implant reconstruction and an oncology nurse of 25 plus years. Today I want to talk about nipple sparing mastectomy, what it is, who might be a candidate, and why this is one of the first questions I recommend every woman ask her surgeon before her surgery date is confirmed. So first, what exactly is nipple sparing mastectomy? In a traditional mastectomy, the nipple and areola are removed along with all of the breast tissue. With this, the incision will be closed without the nipple. In a nipple-sparing mastectomy, sometimes called NSM, the surgeon removes the breast tissue and reattaches the nipple and the areola when closing the incision. This really takes a skilled plastic surgeon, so the breast and nipple are as symmetrical as possible. This matters for two reasons. The aesthetic outcome of a reconstruction can be significantly different when the nipple is preserved. And for many women, the emotional experience of their body after surgery is also different. I want to be honest with you. Nipple-sparing mastectomy is not right for every woman, and it is not always possible. But many women are never told this option even exists. And that's why I'm talking about it today. Before we go further, I want to remind you of something important. In most cases, mastectomy is not an emergency. You have more time than you may feel right now. Time to ask questions, time to understand your options, time to make the decision that is truly right for your body and your life. This is one of those questions worth taking the time to ask and fully understand if you are a candidate and if it is truly right for you. This may mean getting more than one plastic surgeon's opinion, and that's okay. That's really okay to do. The relationship and trust you have with your plastic surgeon will be critical because you will be with that plastic surgeon throughout your entire reconstruction and beyond. I have to say, this is something I really did not realize in the beginning of my journey. Your plastic surgeon and your breast surgeon will work really closely together in the operating room at the time of your mastectomy. The involvement depends on the type of reconstruction that you're having. So who might be a candidate for nipple-sparing mastectomy? I also want to address something that I know is sitting in the back of many women's minds when they hear about nipple-sparing mastectomy. The fear that leaving the nipple behind means leaving cancer cells behind. This is one of the most common concerns that I hear, and it deserves an honest answer. During a nipple-sparing mastectomy, your surgeon removes the breast tissue from behind the nipple and the areola. The tissue directly behind the nipple is called the nipple core. This is typically sent to pathology during surgery to check for any cancer cells. If cancer is found in that tissue, the nipple is not spared. Your surgical team makes its decision in real time during your surgery with your safety as the absolute priority. Nipple-sparing mastectomy is not offered at the expense of your safety. It is offered when your surgical team is confident it is oncologically sound for your specific situation. This is exactly why candidacy matters and exactly why this conversation with your surgeon is so important. Candidacy depends on several factors, and your surgical team is the only one who can tell you definitively whether it's right for you. But here are some of the things they will consider. The location of your tumor. Tumors that are close to the nipple may make nipple sparing less appropriate. The size of your breast. Nipple sparing works differently depending on the breast size and shape. Your overall health and treatment plan, and whether you're having a preventative mastectomy or treating an existing cancer. The important thing is you need to ask the question. Don't assume you're not a candidate without having that conversation with your surgeon. I want to share something really personal here. When I was navigating my own double mastectomy, I was fortunate enough to have a breast surgeon and plastic surgeon who brought up nipple-sparing mastectomy with me. I was a candidate, and I made the decision to move forward with a nipple-sparing double mastectomy. And I'm glad I did it. But I also want you to understand, and I want to be honest with you about what that really means, because nobody told me some of the things beforehand. The emotional experience of waking up and feeling more complete, more like yourself, that's real. For many women, that matters deeply, and it mattered to me. But here is what I want you to know going in. The nipples are preserved, but they're numb. 6 years later, mine are still numb. For some women, the nerve endings begin to regenerate, which can create a painful or a hypersensitive sensation, and the nipples stay firm all the time. That is something to think about when it comes to clothing choices and bra selections at every stage. I have to think about this even 6 years later with every season. Your scar placement will also be different with nipple sparing, something worth discussing with your plastic surgeon so you understand exactly what to expect. None of this is a reason not to choose nipple sparing mastectomy if you are a candidate. But it is information you deserve to have before you decide, so you can walk into that conversation fully prepared. You are allowed to ask about every option available to you. You're allowed to understand what is possible before anything is decided. So here's what I want you to do before your next surgical consultation. I want you to ask your surgeon directly, am I a candidate for nipple-sparing mastectomy? And if not, what are the specific reasons that make it not appropriate for me? That second part is important. You deserve to understand the why, not just the answer. And if your surgeon hasn't brought it up, that doesn't mean it isn't possible. Surgeons cover an enormous amount in a short appointment. This is one of the questions you may need to ask yourself. I want to be clear about something. Your surgical team is extraordinary at what they do. This video is not about second-guessing their expertise. It is about making sure you walk into your appointment as an informed participant in your own care. The more prepared you are, the better that conversation can be for both you and the surgeon. Nipple-sparing mastectomy is actually question number 1 in the guide I wrote for you. The questions nobody told you to ask. If you haven't downloaded it yet, it is written just for you, and the link is in the description below. It walks you through 7 questions, including this one, that every woman navigating mastectomy and reconstruction deserves to ask before surgery. I really wish I had these before I had mine. You found your way here, and wherever you are in this journey, whether you just got your diagnosis or you are already planning your surgery, I'm so glad you're here. You don't have to have it all figured out. I'm here to walk beside you through every question, every decision, every step of the road ahead. If this was helpful, please subscribe. I will be here every week with honest conversations about everything that surrounds the mastectomy and reconstruction journey. And I look forward to seeing you in the next video.